Yes, people, welcome back to the channel. I am Frost P. Here comes episode 4. So with this one, what I'm going to do is I'm just going to teach you about our medical handovers. So as a first responder, there's two ways we do this. We use two different charts, which are abbreviations. So we've got one which is called sample, SAMPLE, we're going to go into, and one that's called ATMIST. Now, even if you're not a medic, these are just key things that you can ask a casualty so you can get a better understanding of what's happened, or you can even give them as a handover. So with samples, the S is signs and symptoms, the A is allergies, the M is medications, P is past medical history, L is last oral intake, i.e. what they ate last, and E is the events leading up to it. So it kind of gives a chart. So if you handed this information over, let's say an ambulance worker or first responder would be able to know what's happened. Do they have any allergies to any medication they can be given? Are they on any medication now? Past medical history, because that could give you a clue. Maybe they're a diabetic, or they've had a stroke or something in the past which has led up, which gives you light on the situation they're in now, and probably more ways to tackle and deal with it. Okay, and then we've got ATMIST. ATMIST is something we use more in-house rather than the handover. So with ATMIST, you've got age, time of incident, mechanism of injury or the mechanical complaint, injuries found, you've got signs and symptoms, well, signs anyway, so that's the vital signs, and we're going to go through the vital numbers, and treatment given. So again, it's a quick breakdown to anybody you're maybe handing over to, or anyone that wants to look and assess the patient. You'd know their age, what time, you'd actually get to know what happened. So that's more for on-site thing. Now, vital numbers that you need to know. Respiratory rate should be between 12 and 20 breaths per minute for a normal adult. I'm not going to tell you what happens outside of these. It's more important that you know what they should be. Heart rate 60 to 100 for a normal adult. Blood pressure, we're aiming for, okay, I'm going to explain it to you better, is in blood oxygen, I should say, and we want that between 94 and 100. So that's how much oxygen is in the blood. Again, temperature should be 36, 37 Celsius, anything around that you want to look at, but that's the ideal. These are all ideals. These are not outside of those bandwidths. It's just to give you a quick few numbers to play with. So if you ever are dealing with a casualty, these are the numbers that pop into your head.